Hi everyone, my name's Janelle. I'm a functional medicine, nutrition, and lifestyle practitioner who lives and plays in the Sierra Mountains, and this is my podcast where we talk about functional health with a mountain twist. I hope this helps you understand your body better and learn ways to improve how you feel, function, and age. Today, I am talking with my friend Anne Lemons. Anne is a seasoned physical therapist and practitioner of functional medicine, nutrition, and lifestyle in Boston, Massachusetts. As a passionate advocate for women's health, Anne empowers her clients to build strong bones with holistic strategies while getting to the root causes of their osteoporosis. She works in partnership with women to help them reclaim their vitality and reach the highest expression of themselves. Anne is not only a certified buff bones instructor and trained in bone fit from the Bone Health and Osteoporosis Foundation, she also brings specialized training in gut health and heart math to her holistic practice. Welcome everyone, and welcome Anne. I am super happy to have you here to share your brilliance with us. And so you and I met a few years ago through our functional nutrition program, and we've worked together in a few different ways over the years, but I just loved your style from right when I met you. First of all, you're a physical therapist, and I've always thought that physical therapists naturally think functionally in that they're not looking to mask the symptoms, but supporting the whole body and considering why imbalances occur. And even if this is like more through the musculoskeletal nervous system lens, but I still think it's super functional. And then you and I both have husbands who are ER docs. So we understand the
That's right.
strengths and the limitations of Western medicine.
Mhm.
And then I just appreciate your no nonsense, straight to the point, forward approach to functional nutrition. So thank you so much for being here, Anne.
Thank you for having me. This is very exciting. I'm always excited to talk to you because we have such similar backgrounds. We have this commonality together. And coming into this space and as a functional medicine and nutrition practitioner and a physical therapist, I had my own diagnosis of osteoporosis a couple of years ago. And what I realized was that there was a huge information gap. This is why I'm so excited to share this information with people, because there's so much misinformation and there's not enough information out there. What I was told when I got my diagnosis was to get on a medication and to just take calcium. And that was from two practitioners in a row. That was it. That was it. And I started, obviously I have a background, so I'm asking questions about nutrition. I'm asking about, uh, you know, supplements. I'm asking about exercise. And they're telling me, this doesn't really help much. And it's just not true. It's
Right.
just not true. The research is showing us otherwise. So that's what got me really excited to be spreading this information about bone health. And from a personal perspective, and I know a lot of people can appreciate this, I see myself 10 years from now as still being very active and doing the things that I want to do. And with an osteoporosis diagnosis, what can happen oftentimes is people they just shut down. They just get so fearful that they stop doing things and they're afraid to do things. And I don't want to be afraid to do things. I don't want to be afraid to lift my luggage. I don't want to be afraid to do gardening and ski and golf and do the things that I want to do. Lift, maybe grandbabies one of these days. But these are the things that women are faced with. They're faced with this choice of medication, or else, you're going to break a bone. And I just didn't accept that. I just don't accept that. And I know there's so much more we can do.
Yeah, and that's what you're doing. I love it. And that is exactly why you're here. I love your passion for it. And I think it's so interesting because I bet you were shocked when you got that diagnosis because I mean, you at the time a physical therapist, a functional nutritionist. So you're doing so much right. Yet you still got this diagnosis. So I find that to be really true with the people I work with. They're doing a lot right,
Mhm.
yet they sometimes they often find out that their bones aren't what they think they are. So
Right.
so this is a problem because we can be doing so much, so many good things and still have this bone issue. And I'm sure we're going to go into some of the reasons that is. But so I really think that is interesting. And then, yeah, what you said, I mean, that advice is so limited and it does not let us reach our full potential and heal in the way
Exactly.
that we need to live exactly like you said, that super strong life as long as we can, right? So that we're in our
Exactly.
70s and 80s and on feeling strong and doing what we love. Yeah. So would you say that's the reason that
E-
this is your work?
Exactly. And it's interesting that you say you have a lot of the same audience that is doing everything right. That's what's happening for me too, for the most part. For the most part, the women that I see, I primarily see women in my practice. They are doing everything right in terms of they're eating really well, they're exercising, but there's still things that they may not know about that are happening beneath the surface in
Hmm.
terms of their root causes. They
Hmm.
may be leaks in the ceiling, to use the analogy from Dr. Bredesen, who talks about, I mean, it's in regard to Alzheimer's, but we can use the same analogy when it comes to bone health. We have to look at all and plug all the holes in the ceiling. It's not just nutrition, it's making sure, are we really absorbing what we're
Hmm.
taking in? It's not just the exercise, it's what type of exercise that we're doing. So this to me is a reframe in that it gives us an opportunity to dig deeper and in the process get way healthier, not just for bone health, but for longevity, just
Hmm.
overall health. This can really, really help. So I think, just to kind of set some context here, just I'm assuming people know what osteoporosis is, but osteoporosis is a disease where the bones get really thin and porous and they lose structural strength, and it makes us more vulnerable to fractures. And the problem with this disease, they call it a silent disease for good reason. The first reason is that 2/3 of the fractures are painless. So there's no signs. Okay, so that's number one, why it's a silent disease. Number two, and I'm calling this my number two for silent disease, we are not having the conversation until age 65
Yeah.
when insurance will pay for a DEXA scan. This is
Mm.
wrong. We need to change this.
So
We
that's just
need
not
to start
functional.
acting.
Right.
It's not functional. It's not functional because we're waiting till 65 and lo and
Hmm.
behold, we're full-blown osteoporosis.
Hmm.
And now, we've got to work really hard to try to stop the bone loss and maybe reverse it even a little bit.
Hmm.
So we have to spread this message that bone health it's not an elderly problem. This is a problem that starts way earlier, and we should be getting our baselines a lot earlier.
Mm.
And DEXA, by the way, is only one way we look at our bone health. It measures bone density. It's not the whole picture, but it is a good base to kind of look and see where we are. Because we want to know what's happening to bone as we age. We've got pretty stable bone density in our 30s, and then it starts to decline a little bit. And then bone density takes a huge drop in this transition from perimenopause to menopause. The research is showing us that bone density is expected to drop between 15 and 20%. So
Mhm.
let that sink in
Mhm.
that perimenopause to
Mhm.
menopause
Mhm.
period. And it's primarily because of the drop in hormones and
Mhm.
more specifically, the drop in estrogen. So all the more reason why we need to be talking about this a lot sooner.
It just needs to be part of our perimenopause transition. It just has to be. Like, it's the same as
Oh,
metabolism for people. Like, no matter what, if you don't change anything, certain things are going to change. So if you don't make mindful changes, your body is going to suffer, and bones is a number one way. And yeah, yeah. I love the way you're
It's
talking, and I'm like freaking out. I was trying to write all these notes to say, "Oh my gosh, I want to double click on that and double click on this." It's so wonderful to have a functional practitioner on who can
Mm.
actually speak in this way and explain how backing it up, doing things before we have a problem, all the different holes in the ceiling, calcium. There is not just one hole in the
Oh,
osteoporosis
no,
or bone
it's not
ceiling.
just calcium. It's
Yeah.
not just calcium and going out and taking a walk.
Mhm,
There's just so much more. And
mhm.
it's funny you say that, because I will get a lot of women that will contact me and they'll say, I just got diagnosed with osteoporosis. What supplements do I take?
Right.
And I go, okay, let's back this up, because that's still treating in a conventional model, which
Yeah.
is a take this for that.
Yeah.
And that's not how we work as functional practitioners. We want to know why.
Mhm,
And if you're new to a diagnosis of osteoporosis, or even if you've had one for a while, you want to be asking that question. Why is it here? What is
mhm,
causing this
mhm.
to, what's driving my osteoporosis? There's not that many really root causes. I mean, inflammation is a big one, oxidative stress, we've got hormonal imbalance,
Digestion and
certainly
absorption.
digestion and absorption, all of these things contribute. So I kind of chuckle when people just want, like, what other supplements should I take?
Mhm, mhm,
And so it's a mindset that we're in, and
mhm,
it can't be helped, because we've been in this conventional medicine model for so long. This is sort of the expectation. So we're out here shaking up the status quo. Like, this is
mhm,
not how we're going to really tackle this problem. We
mhm,
have to back it way, way up.
mhm.
And I'd be happy to share some of the biggest strategies. I've got three strategies
I would
that
love it.
I could share with you today too, to help with your audience. So I kind of broke them down into the three P's. The three
Mm,
P's. The first P is posture. Posture, believe it or not, is to prevent fractures, because that's the name of the game with osteoporosis. Prevent those fractures, because we know mortality rates go up, especially with a hip fracture. We know there's disability, there's long-term pain. I mean, we want to prevent fractures at all costs. We want to be really proactive in that regard. So we want to work on our posture and better body mechanics. Now, these would be considered our mediators. Okay. So this is something we can control. That's
And
when
wait, can we
people,
pause for 1 second, Anne,
yes,
before you go on? You said the word mediator, which is a big word in functional medicine, and a mediator are things that make our condition better or things that make our condition worse. It's just really
correct.
a great way to think about things. So I love that you said that. So our posture is a mediator when it comes
It's
to
a,
bone health.
correct.
Okay.
It could
Mm,
be a negative one, or it could be a
mhm,
positive one
mhm,
in terms of how we are using our posture. And when we're talking about posture, we're talking about preventing one type of fracture, primarily are compression fractures. Okay. There are two main types of fractures with osteoporosis. There's compression fractures and low trauma or fragility fractures. Now, low trauma, just so you've got context here, low trauma, this is if you fall and you break a bone. All right. You put your hands out, you break your wrist, your forearm, your shoulder, you break a hip. That is a low trauma or fragility fracture. If you fracture in that regard, you have osteoporosis. Whether you've had a DEXA scan or not,
mm,
you have osteoporosis.
mhm,
How many kids, when you see kids fall, do they break bones?
mhm.
Not
Right,
really. They fall
right.
all the time. They don't break bones. That's an indication that you've got osteoporosis. Now, compression fracture, that's what I want to talk about, and how we can avoid compression fractures. Compression fractures happen in the spine. They happen in the vertebral segments of the spine. I'm going to show you here. If
Oh,
you
yay.
can
If
you
you're
see,
on YouTube, you can see Anne's beautiful spine.
I've got a
Mm,
spine here. So Basically, let's see if you can, this may be a little, you can see more of the whole
Love
spine
it.
here.
Mhm.
So we should have a curve in the spine. This is the cervical spine or the neck, okay? It should be slightly curved this way. And then the thoracic spine or the upper back has a slight curve this way. And then the low back has a curve in the opposite direction. It's kind of hard to push it here. When we're talking about compression fractures, we're talking about fractures in the front of the spine. So what happens when these vertebral bodies get weakened, the worse our posture gets, meaning the more our head comes forward, we put more compression. Can you see that? Potentially on the front of the spine. And that's where we can fracture. So
Uh-oh. That's what I'm working on.
we can avoid those
Wow.
by just using good posture. And I'm going to explain what that means in a minute. All right. So compression on the front, when the compression forces get greater, this makes us more vulnerable. It is not a one-time injury. This is cumulative injury, cumulative trauma. Because it's something that you're doing day in, day out that gradually makes this happen, not just, oh, I bent over once and I fractured. This has been coming on for a while. That was just kind of the straw that broke the camel's back. So remember, and these are the fractures that can be painless. So I will often have women come to me and they'll say, hey, I got an x-ray for something else. And I have 3 ribs that are fractured. I have 2 vertebrae that are fractured, and they had no idea. One of the ways you can tell if you have a compression fracture is if you're getting shorter and shorter and shorter. So this is why we want to measure our height every year. If you've lost like an inch or more per year, then that could be a sign that you've got compression fractures. It could be other things too, but that's sort of an outward sign that you may have compression fractures. Now, what we want to do posture-wise is we want to get, I'm going to put him down for a second here. We want to get better alignment of our ear over our shoulder and the shoulder over the hip. So if you can't see this on camera, just kind of picture like your earlobe over the shoulder joint and the shoulder over the hip. So for every inch forward that your head goes, for every inch forward. So if we're on our computer, we're on our cell phone, we're driving our car, we're sitting and watching TV, for every inch forward the head goes, it adds 10 pounds to the spine. You could have upwards of 60 pounds more to the spine. And that is what I'm talking about. That increases our risk for compression fractures. So what do we do? Right? So what do we do? So what do we do is when we're sitting, now I'm not in an
I'm doing it right
ergonomic
now. I'm doing it right now.
So when we're sitting, I'm going to tell you what I do for sittings, and then we can talk about, movement. But when you're sitting, if your butt is not reaching the back of the chair, like if it's a deep chair, you've got to put a pillow, something thick back there so that your butt reaches it. The butt has to reach it, okay? Because only if your butt is forward in the chair, you're going to slouch. And I'm going to turn this way. If you're slouched, there's no way. If your butt is under, there's no way it can bring your head back. You've got to get the butt up, right? You've got to get the pelvis in a better alignment so everything else can come back. All right. So that's one way that I do it. Another thing that you can do too is you can take a towel and roll it up the long way and put it in the low back crease. So right at your waist in the back, you can put it there to help recreate that lumbar curve, which helps put everything else in better alignment too. And I will often do this. I mean, you can go buy a lumbar roll online, but you can just use a towel. It's totally fine. And especially in a car for
Mm,
long distance driving or plane trips. So on planes, I'm always bringing something that I can put in my low back so
mm,
that my posture is better. And so it takes in awareness, number one. We
mm-hmm,
have to be aware, like, where is our head in space? You know, if it's way out here, we've got to bring that, the further we bring that head back in line with the body, way less compression force on the spine, way less, we're making ourselves less vulnerable to those types of compression fractures. So kind of, you know, that's the alignment. And then the other thing that I recommend for people that do sit a lot, I mean, I sit a lot, you may sit a lot with your work if we're doing a lot of Zoom work, is to get up every half hour and just move, because you're going to automatically bring yourself in alignment. We are not going to do this 100% all the
mm-hmm,
time. So please don't expect that. That's unrealistic. It's not life. You know, we're going to be slouched. We're going to be, but if you're getting up and moving, you're going to bring yourself in better alignment. You're going to stretch out the other muscles that are getting tight, you know, the front of your shoulders, your hip flexors.
yeah.
You know, when we get our hip flexors tight, we stop using our glutes, which we need for lifting and all of those important things. So getting up and moving is super, super important.
Mm-hmm. So I have to confess something, and I'm like jotting down all these amazing notes that you are giving us, and I'm going to write them in our show notes. But so this is a problem for me. I mean, I am
Yeah.
strong, I'm an athlete, and I have this neck thing, and it got so out of control. My neck just got so bad. And I finally was like, oh my God, I am leaning forward now after being on my computer so much. Yeah, like you said, my phone, riding my bike, even like when I'm
Yes.
running, I'm sort of hunched over a little bit. I
Forward
find that it's
posture.
like everything I'm doing, I am hunched over. So I am trying to be so mindful, like you said. Number one, mindfulness. I'm trying to stretch, like you said, my shoulders this way. I'm totally going to do what you suggested for alignment with my lumbar. I have a question for you. Now, I have a chair
Yes.
that doesn't have a back. So what I've been trying to do is like, I'm a yoga teacher too, is like tip my pelvis forward,
Mm-hmm.
like tell me,
Yeah,
should I
anterior,
do this?
anterior tilt. Yes, so if you've got your pelvis,
Mm-hmm.
you want to tip it a little bit forward, you'll be able to bring the spine in a better alignment. If the pelvis is tipped backwards,
Mm-hmm.
then you don't really have a chance.
Okay. So
So
that
tipping
still
forward,
could work for me if I don't have a back
yes.
to
Oh
my,
yeah, absolutely.
okay.
Because
Okay.
you can be sitting on like a stability ball. Some people like to sit on stability balls instead
Mm-hmm.
of chairs. Here's the key thing, and you know this as a yoga instructor. You want to feel your sits bones, or your we call these are your ischial tuberosities, right? These are your sits bones. If you can feel your sits bones, you know, all of them, and not you're rocked back on them, then you know you're in a better pelvic alignment,
Mm-hmm.
which will help the spine to be in better alignment as well.
Okay. And then I like your
Another,
cue about your ears, because then from there, I'm going to take my shoulders and then bring my ears back above my
ex
shoulders, you said, right? Is that what you said?
exactly. You
Okay.
kind of want to set the pelvis first.
Okay.
Get the pelvis there first, and then you want to get the shoulders over the pelvis, and then you want to bring the head, back.
Okay. I'm going to have my
Because
little Anne fairy in my head now every day, and I'm going to do all pelvis, shoulders,
shoulders,
ears. I'm doing
ears,
it.
right? Yeah,
Okay.
perfect. That's awesome. That's awesome.
And
It's
it feels
really
like I'm doing a back bend. It like literally, when I come into
so,
alignment, it feels like I'm doing a back bend. This is not good.
so the other thing too, I mean, and this is kind of getting off a little tangent, but you know, we want to be doing postural strengthening exercises. So there's
Mm,
sort of postural awareness, but then there's also postural strengthening, which you could probably benefit from.
mhm,
You know,
mhm,
that's any of the back extension work
mhm.
that we do, that you probably do in yoga as well. So all of that can help to open up the front. I mean, stretching is great, but you got to strengthen, because that's just
Mhm,
not going to hold. It's just
mhm,
not going to hold.
mhm.
Right. So
Maybe we'll do our
awareness,
next podcast on that.
awareness is number one. That's
Uh-huh.
key, right?
Mhm.
All right. The second piece
Yes,
of
second.
this, I just want to quickly
Oh,
say
oh.
body mechanics, learning how to hinge correctly
Mm,
is critical. And all this means is we don't want to bend from the waist. We want to bend from the hips. All right. And I'm going to do this quickly.
mm.
I know we want to talk about lots of stuff here, but basically, if you take a dowel or a yardstick or a broom handle
So
and you
she's
put it
standing
behind,
again if you're not watching
and
this. You
if
might want
you're
to
not,
check her out on YouTube.
yes. So what you're going to do is you're going to take that and put it on your back, on your spine,
Mm,
and you're going to have 3 points of contact with this:
mm,
the back of your head, your upper back, and your sacrum.
mhm,
Okay. And from
mhm,
here, we want to practice bending,
mm.
keeping all points contacted to that dowel. All right. So
Brilliant.
they have to all be touching. So if we're bending forward and we're doing this, nope, that's too much compression force. We want to keep it straight as we're hinging forward. That can save lives right there,
Wow.
because that's how we want to be lifting. That's how we want to be bending forward, whether we're gardening, emptying the dishwasher,
Hmm.
getting things out of the laundry, is the
Hmm.
hip
Hmm.
hinge. And just,
Hmm.
I have a ton of videos on my social media on how to do this if
Hmm.
somebody
Hmm.
wants,
Hmm. Hmm.
more instruction. But I couldn't not mention it because it's such an important piece. And that's how people fracture, is that bending forward from the waist.
And I'm even thinking like tightening my ski boots. Like there's so many times we're bending, of course, the dishwasher, but okay, I love that. That is brilliant. So that is
Yes.
all part of the
Of posture,
posture, the P.
the P. All right. Second P would be to pump iron. Now, I know this is your
Hmm.
wheelhouse. Pump
Hmm.
iron. We
Hmm.
know that we have to build muscle, and we've got the research behind, why we need it. Muscle affects the bone, it affects mobility. And what the research is showing us now is it's even more important for fall risk, even more important than a low bone density score, is weak muscles,
Hmm.
because it increases our fall risk exponentially.
Hmm.
Exponentially. So we have, peak muscle mass around age 25, and we lose about 3 to 8% per decade. By 50, we lose about 15% per decade.
Hmm.
So bone loss, muscle loss starts to really amplify as we get older, again, mostly due to hormone
Hmm.
decline.
Hmm.
So how does muscle help build stronger bones? So this is basically by Wolff's law. He was a German anatomist and a surgeon. And what he said was bone responds to stress, and it responds to stress. It adapts to stress. So what that means is we can build muscle, or we can build better bone through muscle strength or through impact. So muscle helps to build stronger bone. So if you think about it, the muscle is attached end to end to bone, and the stronger that muscle is, the more pull on the bone adapts to that stress and will get stronger. So basically, we have to give our bones the message, hey, we still need you. So we need that strength, so it keeps sending the message to the bone.
So it stimulates, that bone needs to be stimulated. It needs to
Yes.
be stressed physically by the muscle.
Correct. By
Mhm,
muscle
mhm,
and by impact. So that's like
mhm,
weight bearing, that's like
mhm,
jumping, that's running,
mhm,
that's going up and down stairs. So those are the two ways that we build bone.
mhm,
Okay.
mhm,
Now, how we do this and specifically build muscle is through progressive resistive exercise.
mhm,
So this is key. Here's my mistake in my 50s. I'll share this with you because I think there may be a lot of women that are out there doing this. I was focused on more yoga and Pilates.
mhm,
It's not enough. It's
mhm,
absolutely 100% not enough. And we have the research to back this up. and looking at these meta-analysis of yoga and Pilates, does it actually build bone? There's not strong research to support it. Now, that said, if you're doing yoga and Pilates, please don't stop. It's a
Yeah.
phenomenal. Please don't stop doing it. It's phenomenal because
Mhm.
I mean, core strength is amazing,
Mhm. And
and balance,
mobility. Mhm.
mobility and
Mhm.
balance. And these are
Mhm.
the things, remember, we want to prevent falls. We want to prevent fractures. So really, really important. However, we want to add
Mhm.
more resistive exercise to the program. And
Mhm.
that means your free weights, that could be bands, it could be tubing, it could be cables, it could be the machines, but it
TRX.
needs
Mhm.
TRX, it could be
Mhm.
any of that.
Mhm.
But it has to be progressive. It has to get
Mhm.
harder and harder and harder
Mhm.
so that we keep sending that message to the bone. We still need you. We still need you.
Right.
You've got to build. All right.
I
So
love
I didn't,
the phrase. You just reminded me of this. I've kind of forgot about it over a few years, but like you should do a couple of workouts that suck. Like they're
yes,
hard. You know,
it's
like it's
really
okay for it to be hard. Like that's what builds
exactly.
muscle and bone,
Exactly.
right?
And then we give
Mhm.
it that repair time, and
Mhm.
that's something else too. I just want to add a little side note here is that for the menopausal woman, that recovery, be very respectful of the
Mhm.
recovery time
Mhm.
because we don't have the same hormonal balance that we had, before menopause. And it may take longer to repair because estrogen is so important when it comes to repairing muscle.
Mhm.
So take the time in between to get good repair, but then, go at it. I just wanted to share with you too. There's a great study. It's the Liftmore trial that was done, and this is when I hear, 'cause I still hear it from patients and from doctors, that exercise doesn't help osteoporosis. The Liftmore trial showed that the high intensity resistance and impact training definitely improves bone density at both the hip and the low back, more so in the low back, the lumbar spine. But they took about 100 women, postmenopausal women with low bone density, and they gave them 4 exercises. 3 were strength, 1 was impact, and they all improved, and there was no injuries. But they had very good supervision by physical therapists. So when you're doing exercise, I always say, please get the right instruction. Ideally, initially, if you've not exercised, work with a PT that can evaluate you to see, where you need better, you may need more work first,
Mhm.
than, going right into it with a personal trainer that may not be able to assess as well where you're
Mhm.
deficient or where you've got mobility issues or postural issues, anything like that.
Yeah, that's really good advice. And you just reminded me too. I mean, I love studies, of course. Research is so important. It can be so helpful. But like even in a study like that, things are hard because we don't know even how much protein were those women getting? Like, were they getting enough protein to build muscle? Were they taking their rest days? How were they sleeping? You know what I mean? Like, yes, I'm glad
Exactly.
that it did prove that, but sometimes these research papers are limited in how we think, kind of back to what we were saying in the beginning. In Western medicine, they're testing one thing. And we're like, okay, well,
Exactly.
who is the individual? Like, how
Right.
are they
Right.
like breaking down and absorbing their protein or their calcium or their magnesium? Anyway, so yeah, it kind of like
Great
tell,
point. Great point. Absolutely. And at least this is a start in the right
yes,
direction.
yes, yes,
Right.
yes,
So
yes,
we've got, because we've been saying it forever. Yes, exercise helps, especially physical
yes,
therapists. But now we've got some proof. I mean, there's
yes.
other studies, but that one is good. Speaking of protein, that's my third P.
Oh,
That's
wow.
my third
Well,
P.
what a lovely
What
segue.
a lovely segue. Yes. They're the building blocks of muscles and bones, right? We have to get that. And what the research shows, and I will say that I am research based, but I'm not research bound. So I like to
Amen.
say
Me too.
based, but not bound by it,
Mhm,
right?
mhm.
But it gives me a jumping off point.
Yes.
And I want to read the research. I want to
Yeah.
see like
Yeah.
what is out there, what are they doing, what the research shows in terms of, do we have exact amounts of protein? No. However, what they found is that the women with osteoporosis that were taking higher amounts of protein were correlated to higher bone density. So this is helpful. I see several problems with protein, and we've kind of touched on that. Number one, women are not eating enough. That has been across the board for me. Number two, they're not digesting and absorbing it. And number 3 and 4, so many people are using medications that interfere with the absorption of protein, like proton pump inhibitors or antacids, and stress. I mean, let's talk about, lifestyle piece. Stress is huge at limiting how well we're absorbing protein. Just this week, I was talking to a woman who's like, "Oh, I get plenty of protein," and I started looking at her food diary, and for breakfast she has 1 egg. So, I mean, very typical. I'll see, women will have a cup of yogurt with a piece of toast or an egg, and it's just not enough. It's just not enough. But we have to not be piling on more protein until we're sure on how we're breaking that down.
Right. How's our stomach acid? How's our
Low acid,
enzymes? How's our
low acid
lining?
is huge. Exactly. It's huge. And we know that as we get older, the acid in the stomach just kind of naturally decreases. And then if you add stress to that, we're not going to be breaking down food, and especially protein, that well either. So
these are so many brilliant things. And we're kind of running out on time. So we need to, you have so much information, and I'm going to tell people how to find you, because if people have bone concerns or want to age their best, this should be one of their concerns. And so finding you would be definitely one of my top recommendations. But before we tell people how to find you, what else should we add? We've talked about posture. We talked about pumping iron. And we've talked about protein and so many other nuggets in there. But anything else, like what would you want to end with?
I guess I would encourage women to get a DEXA scan, even if you're not 65. If you're younger than 65, I would really encourage women to do that. They're not horribly expensive. They may be around $150. So you can get one without a prescription. Or you get a prescription, and I'm not sure that insurance will pick it up. Depends on what your risk factors are, but know what your baseline is.
Know what your baseline is. Then you can know which way you're moving as you grow older.
So that's it. A diagnosis does not mean that you will fracture. It does mean you need to take action. Better to know what that action is, much sooner than 65 or older. All right. And just know that, there's so much hope, and there's so much we can do to fortify our bones. We don't have to take this as that's it. The only thing I have to do is medication. There's a lot more that we can do. And there's a lot more to uncover in terms of the root causes. So just know that you can change the trajectory here. This is not a set in stone thing. And I don't care if you're 40 years old or you're 80 years old, you can still be doing this work.
And it should be on your mind because of our drop in hormones. So all of us should be thinking about this and taking action. And I adore you. I'm so happy that we get to work together. I'm so happy that you came on this podcast. Thank you so much. If people want to find you, where's the best place to do that?
So I'm all Anne Lemons Wellness. So you can find me on social media. That's probably the best place to find me. I also have a YouTube channel. I've got some free downloads for you too. So check out my social media, my YouTube channel. It's all Anne Lemons Wellness, and it's Anne with an E. Lemons like the fruit.
And you're working on a bone health program, which I'm so excited about. So sometime soon, hopefully that will be ready.
Exactly. Awesome. Thank you for having me, Janelle. This was so much fun.
Yes. Thank you so much, Anne. Okay. Well, we'll hopefully talk soon. I know we will. Bye.
Bye.
That's it for this week. If you enjoyed this podcast, please leave a comment and review, as that helps more people find out about it. You can find me and the courses I teach at mountainrebalance.com and on Instagram. If there's a topic you want to hear about, please reach out and let me know.